Thank you.
Okay. Are you able to see my screen?
Yes, ma'am.
Yes, ma'am. Okay. Today we are going to see about musculoskeletal system surgery procedures. Okay.
Okay.
So first we'll see about the what are the anatomical part involving in that musculoskeletal system. Okay. So in this first we are seeing about how the musculoskeletal system is involving. Uh, um, yes, that in the previous class we have explained about that integumentary system, which involves about epidermis, dermis, and hypodermis, those and all. In the musculoskeletal system, muscle and bone we are going to see. Okay, so one by one, the anatomical part we will discuss in the musculoskeletal system. First, we are going to see about the tendon. What is tendon? So, tendon is a strong connective tissue that is attached with muscle and bone. That is connecting the muscle and bone. So, it is like a strong fibrous tissue. Okay, so normally that skeletal muscle will react easily, then it will tire easily. So it is considered as a trimmer's muscle, like that only. Okay, so you can see here they have given how the muscle and that connective tissue connected with the bone. So this is a muscle, and this tendon is here. It is fibrous structure, and it is connected with the bone. So you can see that different anatomical parts they have given the tendon where is placed. So this is a arm, and this is a leg area. They have given an example. So this is a muscle, uh, gastrocnemius muscle. Then this is a tendon. So origin of a gastrocnemius tendon, and this is a insertion of gastrocnemius tendon. Then next to that, they have given a bone structures. So they have given a radius and ulna. Radius ulna located in the forearm area. So radius is a very thick bone, and ulna is a little thin bone. So that anatomical part they have given here. So this is articular facet and the articular circumference, and this is a neck area and the radial tuberosity, anterior border of ears, and introcaeus border of the radius, and ulnar notch. This ulnar notch only, that ulnar and radius is connecting, and this is a styloid process. Then in the ulna, this is a olecranon process, and this is a trochlear notch and coronoid process displays, and radial notch. Radial notch, it is connecting the radius. Then ulnar tuberosity and intracaeus border, anterior border, articular circumference of the ulna, and styloid process. Okay, so this is a forearm area bone. And in the humerus means upper arm area. So upper arm area, the bone structure they have given front and back. So this one intertubercular, which means bicipital groove, and greater tubercle, then a lesser tubercle, lateral supracondylar ridge, then radial fossa, coronoid fossa, capitulum, head of the radius. So this radius connecting with the humerus in this. Okay. Then here head anatomical neck. This is a surgical neck. these are all very important for the fracture coding. Okay, so they will mention humerus head, anatomical head, surgical neck fracture of the humerus, like that they will give. So that's why we should know the anatomical part of every bone. Okay, so this is a shaft. Shaft means every bone that middle stem part is called as a shaft. Then medial supracondylar ridge, then medial epicondyle, and next one this olecranon fossa. Then lateral epicondyle, head of the radius. This one radius is connecting like this way. Then this is a radial groove, greater tubercle. Okay, so they have given a anterior view and posterior view of the humerus, which means front and back. Okay, then next to that, tibia, fibula. You can see tibia fibula where it is located in the leg area, which means lower leg area. So lower leg area, this tibia is a very thick bone and fibula is a little thin bone. So in that tibia they have given anatomical part, intercondylar eminence. Then this is a medial continent. So likewise anterior and posterior view how it will be, like that they have given. So tibial tuberosity, anterior crest, and tibial bone. So this is a place, shaft area. Then this is a medial malleolus and articular surface. This medial malleolus, it is connecting with the tarsal bones. That place is located in the ankle area. Okay. Then this is left side. They have given a fibula bone. So fibula bone, proximal tibiofibular joint, fibula head, and this is a fibular shaft and the distal tibiofibular joint. And this is a lateral malleolus. Likewise, they have given a in this side also articular surface of the lateral condyle, then fibula head, then intraosseous membrane connecting with the fibula and tibia. Okay, next to that, femur bone, which means thigh bone. Okay, so the femur bone is connecting with the hip and knee area. So the anatomical part they have given an anterior view and a posterior view of the femur. So here this is a intratrochanteric line and greater trochanter, then patellar surface, which means that the patella is the that ball shape bone located in the knee area. So in that place, that patella bone will be located. So that is a patellar surface. Then lateral epicondyle, lateral condyle. Then this is a head of the femur bone, and this is called as a fibia capitis. Then this is a neck area and trochanteric fossa. Then lesser trochanter. So every anatomical part will be important for the fracture coding. So based on that anatomical part only, we have a individual ICDs for fractures, and also for the procedures also, that the anatomical part is very important. Then lesser trochanter, and this is a shaft, and this is a linea aspera. Then medial supracondylar line and popliteal surface. In this place only, that popliteal artery and veins and all will be passed. Then intercondylar line, then abductor tubercle, then medial epicondylar, medial condyle. Then in that lateral side, that lateral condyle will be there. Then lateral epicondyle will be there, and this is a intercondylar fossa. Then supracondylar line. So some shape will be there. It will be downward, that image. Okay. So next one, in this place, pectineal line. Then this is a gluteal tuberosity. Then greater trochanter. Then this is a introtrochanteric crest. Then next to that, this is a shoulder area. So shoulder area, what are the anatomical part located? They have given in the image. So here they have denoted the what are the ligaments located in the shoulder area. Acromioclavicular ligament, coracoacromial ligament, then coracohumeral ligament, then transverse humeral ligament, then this is a conoid ligament and trapezoid ligament, then coracoclavicular ligament. That two is called as a coracoclavicular ligament. Clavicle means our collarbone connecting fluids. Okay, so this one, that muscles, what are the muscles involving in the shoulder area, they have given for the front and back side of the shoulder. So here sternocleo uh, Cleo, cleomastoid, then trapezius, then a deltoid muscle, and this is a biceps muscle, then pectoralis major muscle. Then backside, if you are seeing, means that a trapezius and a deltoid muscle, teres minor muscle, and triceps muscles, and rhomboid major muscle, and this one, and this yellow color is the infraspinatus muscle. Then this is the teres major muscle. That is a teres minor. This is a teres major muscle. And next to that, they have given a humerus, that what are the ligament present. So you can see lateral collateral ligament, then annular ligament, and medial collateral ligament, medial epicondyle area. This one. Then this is a oblique cord ligament. Okay, then next one, this is a carpal area, which means our wrist area. So wrist area, what are the ligaments located, that what they have given here. So lunotriquetral ligament, then scapholunate ligament, which means and the radioscapulonate ligament, which means that carpal bones connected with the inter ligaments, right? That one they have given based on the bones name, they have given a ligament name. Okay, so next one, knee area, what are the bones and anatomical part present, that one image they have given. See this one, quadriceps muscle, that a brown color they have given, no? This is a quadriceps muscle. Then this is a femur bone. So femur bone, it is like a W shape. It will be that a W shape. It is connected like this only. Then this is a patellar bone. I said right already that a ball shaped bone, that is actually sesamoid shape will be there. This patellar bone. Okay. Then this is a meniscus. So in between the tibia and the femur bone, there will be some ligaments and cartilage will be there. So that that cartilage is meniscus. Here it is located. Okay. Then this is a ligaments connected, lateral collateral ligament, then anterior cruciate ligament and posterior cruciate ligament. It will be like X shape. It is connected. Then this is a medial collateral ligament. So you have to know the difference between a lateral collateral ligament and medial collateral ligament. This lateral collateral ligament will be located in the outside of the body side, which means it is if in case if it is a right knee, means our right hand side, that ligament will be there. Okay, so this medial meniscus means towards the body side, means inner side of the body side, that medial collateral ligament will be there. Okay, then this is a articular cartilage. So this is the anatomical part of the knee area. So this is a tibia bone and this is a fibula bone. Then next to that, that hand area, what are the bones located, that one they have given here. So first, this is a wrist area, which means carpal area. So there is a 8 carpal bones will be there. So we can see that trapezium, trapezoid, then capitate, hamate, pisiform, triquetrum, lunate, scaphoid. So these are the 8 carpal bones. Then this is the bone is located in the our palm area, that is metacarpal bone. First metacarpal, second metacarpal, third metacarpal, fourth metacarpal, fifth metacarpal, like that they have given a name for the metacarpal bones. Then next to that, phalanges. These are the phalanges which is located in our finger area. So this that phalanges bones, every phalanges bones has a three bones, which means proximal phalanges, middle phalanges, and distal phalanges, like that. So in this also we can see every bone has a head, shaft, base. Okay, so in this distal bone, phalanges bone also has a head, shaft, and base. Like that, every individual bones head, shaft, base will be there. Okay, not only for the phalanges bone, that metacarpal bones also head, shaft, base, like that we can um, identified as the anatomical part of the each and every metacarpal bone. Okay, then in this greater means thumb area, we have only two phalanges. So proximal and distal phalanges only, and this that cap-like structure will be there. That is very important for the ICD code. Okay, and the joints you can see here. So what are the joints involving in this hand? So you can see this carpal bones and this radial bone connecting places, radiocarpal joint, and carpal bones and ulna bone connecting places, ulnocarpal joint, like that it will be. Okay, so under this one, carpal bones and metacarpal bones, that is connecting place is called a carpo-metacarpal joint. You can see this is a place, is a base of the thumb joint. Okay, so next this metacarpal bone, and it is connecting with the phalanges bones. It is called as a metacarpophalangeal joint, which means this is a metacarpal bone and this is a phalangeal bone. Connecting place is a metacarpophalangeal joint, that is called as a knuckles. Okay, like that, in that thumb area, that connecting places also, that interphalangeal joint of the thumb, which means that one bone is connecting with that uh, um, phalanges and the metacarpal. That is interphalangeal joint of the thumb. Okay. Then here this phalanges bones, proximal bone or middle bone and distal bones connecting place is there, right? That place, that joint place is called as a generally interphalangeal joint. Okay, so you can see distal interphalangeal joint, proximal interphalangeal joint, like that they have given a name. So that this place is a distal interphalangeal joint, and this one is a proximal interphalangeal joint. Like that, we can call the joints of the phalanges bone. Okay. Then next to that, this is a palm area. They have given a different anatomical name. So they have given a five zones. They divided into five zones of the thumb area. You can see first one, zone one, that is a distal area, to distal to submilis. So distal to sublimis. Then next one, zone two is a no man's land. Then zone 3 is a lumbrical origin. Then zone 4 is a carpal tunnel. Then zone 5 is a proximal to carpal tunnel. So this carpal tunnel, we are getting one syndrome that is called as a carpal tunnel syndrome. Based on this name only, that condition is named as a carpal tunnel syndrome. Next to that, foot area. So foot and ankle area, you can see here what are the bones involving. So previously we have seen that tibia and fibula, right? So along with that, this talus bone will be there in the ankle area. So you can see this lateral malleolus and medial malleolus connected with this talus bone and this calcaneus bone. Calcaneus bone located in the ankle area. Then this is a navicular bone. This navicular bone, you can see many tarsal bones will be there. That tarsal bone is named as a lateral cuneiform, middle cuneiform, medial cuneiform, and cuboid bone, like that. They have given a different names for the tarsal bones. Then next to that, it is a metatarsal bone. Metatarsal bone, how it is like a metacarpal bone in the palm area, like that in the foot also. That bones will be there, 5 bones will be there. That is called as a metatarsal. So based on the numbers, first metatarsal, second metatarsal, and third metatarsal, like that it is named. Then next to that, phalanges in that toe area also. That phalanges, they are getting proximal phalanges, middle phalanges, and distal phalanges. You can see that greater toe, that proximal phalanges of the greater toe and the distal phalanges of the greater toe. Okay, so like that they have given. So for ICD coding, we can check mostly for the greater toe separate ICD, and for the lesser toe there is no individual ICDs for the each lesser toe. So they will give lesser toes. Then next to that, the joints they have given. So ankle joint, then a talonavicular joint, which means talus and navicle bone connecting place is a talonavicular joint. And that next one is a metatarso cuneiform joint. Then first metatarso proximal joint. Then calcaneo cuboid joint and subtalar joint. So we have seen about the anatomical part of the musculoskeletal system, and now we are going to see about the that coding part of the musculoskeletal system in the surgery topic. Okay, so we can see the codes range based on the anatomical part. It is aligned. You can see this is a general musculoskeletal procedures from these series. Then head, neck, thorax, spine, shoulder, humerus, elbow, forearm, wrist, hand and finger, then pelvis and hip, then femur and knee, foot and toes. Like that, it is aligned. That codes also aligned like that one wise. Okay. Then next one, general CPT coding guideline. As per coding, how we are following. First, we are going to see about the what is the procedure performed. So procedure performed, but not based on the diagnosis. One or two rare cases, so they will mention for that specific conditions, like this procedure is performing for the neoplasm, not for the other disease, like that they will give. So some of the procedures, so they will mention about the diagnosis, but most of the procedure, what is the procedure performed, that only priority. Okay, then next to that, anatomical site, which anatomical site they are performing. Then approach, what is the approach they are performing, whether it is a open approach or it is for the laparoscopic, like that they will give the approach. Then next to that, CPT parenthetical notes, but do not unbundle components of the bundled procedure. So whenever we are coding that procedures, so if in case some scenarios, if it is a bundled procedure is there, we have to prefer the bundled procedure CPT code, not for the individual codes. Okay. So next to that, CPT parenthetical notes is there, right? So CPT parenthetical means I have said, right, for this CPT particularly some concept is there. So if they want to bundle means it will be bundled. For this procedure, we have to see these anatomical site it is covered means that one we have to check. Then that particular method they have followed means that one we have to check. So every individual CPTs, is there any parenthetical notes is there means that one we have to follow carefully. Then next one, the what are the procedures, then how they are performing, that one they have explaining here. So first one is a open procedure. Open procedure means it is a open surgical procedures. So they are making some cuts and exposing the operative site. That is a open procedure. Then they will do the procedure. Then percutaneous method means by using the needle, catheter, or wire, we are approaching the place through the skin, making some small puncture or hole. Okay, so that is a percutaneous method. Then next one, arthroscopic. Arthroscopic means scope assisted joint procedure, by using the any scope. Okay, So then arthroscope CPT codes including the diagnostic arthroscopy. So unless it is stated otherwise, okay. So they have to mention. Then next one, arthroscopic partial medial meniscectomy. They have given an example 29881. So by using the arthroscopy, they are doing the procedure. We have to use the CPT 29881. Okay. Then next to that, we are going to see about elaborately that musculoskeletal system. So in the musculoskeletal system, what are the anatomical part involving means bones, joints, muscles, tendon, ligaments, and fascia. Okay. So commonly for the musculoskeletal system, coding concept, what are the elements we have to check? So for that, they have given some notes here. So first one, open versus closed treatment. If it is a open procedure means they will make a incision and they will do the procedures. Closed procedure means like some of the procedure without making the open, they will fix. For an example, if the patient got any sprain or strain, by using the cast or splint only, they will fix that issue. So that is a closed method. So so you can see example, closed fracture reduction manipulation without incision, which means for an that cast splint and all, they are fixing, but this one they are not opening. Then open fracture means incision and internal fixation. Then with or without a manipulation means, with manipulation means, for an example, if shoulder is dislocated, so in that time what the physician will do first, they will fix that uh, dislocation. So they will, by rotating the hand only, they will relocate the dislocated bone. So that is a manipulation they are doing. So that is a manipulation. Without manipulation means, so without doing anything, they are doing with the cast and splint and all without manipulation. They won't do manually any corrections, but by using this some supportive things, they are fixing the fracture. That is called as a without manipulation. Okay, so you can see this examples 23505 and 23500 for the with manipulation and without manipulation CPT examples. Then global fracture cares. So global fracture cares, while coding, we have to see what are the initial evaluation, what is the treatment is done, and what is the follow-up care. Those and all we have to check. Then some this is an important category. Whenever we are coding surgery, in that time we should not code ENM. That is uh, should not separately billable. Okay, so ENM service performed for done for that particular fracture treatment means, in that time we should not give a ENM code for the that that particular surgery procedure. Okay, then along with that, if in case casting, splinting and all they are providing means, for the first service means first time they are giving that cast and splint means, we should not bill for that fracture fixation CPT. Okay, so which means that is inclusive in the particular procedure code. So second time they are coming for that cast and splint means we have to bill separately, but first time that cast and splint we should not bill separately for that particular surgery code, that is inclusive. Okay, so we can see in that musculoskeletal system some procedures will be given in the first criteria, which means incision, wound exploration, excision, introduction, and removal. These are not only for the musculoskeletal system, all procedures wherever surgery part we are going, it is they have given that incision, wound exploration, excision, that introduction, removal, which means that is generally they will do that procedure, which means common procedures they will do in the each of the every surgery in a means every system surgery part they will do. Okay, means for an example, musculoskeletal system they are doing that incision. Then if we are going for that other system also, they will do the incision, like that it would be. So every system surgical part that integumentary system will involve, because if they are doing for the digestive system any procedures, means they have to make a open with that skin, right? They have to first approach the skin, then only they can reach that internal part, right? So like that only, these are the procedures involving in the every systems. It is related to the integumentary system. So first we are going to see about the wound exploration. Wound exploration means uh, whenever we are going to see about the any penetrating trauma. Penetrating trauma means that a gunshot wound, a stabbing wound, those and all. How much deep that the wound is got affected. That one we have to check. That is the meaning wound exploration. So they will check about the how much deep, is there any foreign body is there, or is there any debridement we have to do, those and all we have to check by using that wound exploration. So whenever they are going to code, if they mention that wound exploration, means we have to use the wound exploration codes. Okay, so in that wound exploration, if in case any repair is done, means like simple repair, complex repair, intermediate repair, those and all we have to additionally we have to code. For the wound exploration means we have to use the CPT series 201002 20103. Okay, then tumor excision. So tumor excision in the integumentary system you have seen, right? So how we have to calculate the tumor size, that resection, those and all we have to check. In this tumor excision, um, simple and intermediate repair is inclusive. If you are seen in the integumentary system, they have mentioned only simple repair is inclusive. But intermediate and complex repair performed means we have to code additionally that repairs. But coming to that musculoskeletal system, if they performed simple or intermediate, that is inclusive in these procedures. We should not separately bill, because that is inclusive in the particular CPT procedure of the musculoskeletal system CPTs. Okay. Then margin calculation, those and all, how we are following in that integumentary system, like that only. That tumor size along with that margin size, we have to add and calculate the resection size. Okay. So how they are removing the excision, like that only we have to follow. Okay. Then next to that, if in case if they performed that vessel exploration, then neuroplasty, those and all they have given, means that should be reported separately. Okay. Then next one, that excision concept, if in case any complex repair is there, means that one additionally we have to code. And next one, the CPT series will be that 114002 11446. These are the CPTs involving in the soft tissue tumor excision. Then in this excision of the facial or subfacial soft tissue tumors also, like that only, what are that followed in the previous one, like that fracture care, those and all inclusive in that CPTs. So simple and intermediate repair is inclusive, and complex repair is there, means additionally we have to code. And this, what are the anatomical part they have given, based on that we have to give the CPTs for the excision. And that calculation of the tumor size and margin size, it will be same. Radical resection also, like that only. So in these places, if in case they are doing that adjacent tissue transfer, and if in case flap this and all, if they performed, means that should be coded separately. Okay. But in that excision place, normally we won't code adjacent tissue transfer is there, means only adjacent tissue transfer we will code. But if they are doing that procedures like connective tissue tumor or radical resection tumor, if they performed, means that adjacent tissue transfer should be reported separately. Okay. Along with that, these are already exploration neuroplasty also, reconstruction performed, means that also should be coded separately. as like that a radical resection of bone tumors also same concept. So complex repair is there means that that one should be repeated separately, and this adjacent tissue transfer and exploration and neuroplasty, those and all vessel related procedures and reconstruction performed means that one re, need to report separately. Okay, then next to that, fracture care coding. So fracture care coding means there is a four type is there. So you can see first one is closed treatment without manipulation. Closed treatment without manipulation means this one. So they are not doing the manipulation. Cast only they have applied. So that is a closed treatment without manipulation. Next one, closed reduction with the manipulation means this one. So doctor is fixing that that sprain or strain or fracture by using their manual approach. Okay, so that is a closed reduction with the manipulation. Then percutaneous fixation means by using this rod or plate or multiple wires, pins, screws, they are approaching through the skin, they are treating that abnormality. Okay, that is a percutaneous fixation. You can see that multiple screws and rods they are supporting for fixing that particular fracture. Then open reduction with internal fixation means that open surgery how they are doing. They are opening the skin and they are fixing that fracture by using screws or wires or plates. They are fixing the fracture. That is a open method. Okay. Then fracture care global package, how they are following that one they have given here. So what is the global period? Means 90 days is a global period for the fracture. So within the 90 days, if the patient is coming for the same conditions, some procedures are inclusive. Some treatments are inclusive. They no need to pay again. Okay, but some of the procedures it is not inclusive means that one they have to bill separately. So that is a concept is following the global package. Okay, so if the patient is coming for that humerus fracture, so first time they are fixing the plate and screws for that fracture. So within the 90 days they are coming for removing that plate and screw means that is inclusive procedure, so no need to bill separately. Okay, within the 90 days if they come means that is inclusive. After the 90 days they are coming means that is separately billable, so patient need to pay. Okay, so patient or insurance company need to pay. That is a concept is the global package. Okay, but in some procedures that is not inclusive like that they will mention. Those are they have given here, includes and excludes. So includes means restorative treatment or procedure, which means that is follow for that procedure means that is inclusive. Then all post operative visit. So second time that post operative period is a global period. Okay, so within the 90 days is called as a post operative period. So all within the 90 days that follow up is doctor fixed means that is post operative visit, that all visit is inclusive in that fracture care. Okay, within that 90 days. Then initial application of the cast or durable medical equipment device, which means I said right, cast and splint first time they are giving means that is inclusive in the procedure. But if they are coming within the 90 days, second time they are removing the cast again, second time they are applying means that will be billable, separately billable. Okay, then next to that excludes. So within the 90 days they are taking x-ray means that is separately billable. To check how it is fixed means they will take some x-rays. So in the time that x-ray is not inclusive in this fracture care coverage. So if x-ray is there means separately billable. Then replacement or subsequent casting or durable medical equipment device. These all are, I have said right, this cast and splints and other equipment devices and all. If their second time they are placing means that will be separately billable. Then all supplies provided. Supplies means that medical equipments or medicines, those and all used to call as a supplies only. So that and all not inclusive in this global package, that is separately billable. Okay. Then next to that, rules for the fracture care coding. So while coding the fracture care, what are the rules we have to follow? That one they have given here. So first one, initial fitting of the cast, splint, strapping, and other materials are included in the global service of the fracture care. So initial fitting, that one we already discussed. Then ED physician bills application of the cast for the temporary casting. Orthopedic surgeon bills for the restorative fracture care CPT codes. So ED physician, if in case giving that temporary casting or any that surgical things they have given means that one, um, that will be billed for the ED physician, and that surgical physician will be code the that whatever fixing. Okay, that will be inclusive in this surgical physician coding. Okay, so for an example, this close treatment reduction and percutaneous bending and RF means it is fracture reduction. Those and all for the surgical surgeon bills. Okay, then in a hospital setting, the facility bills for fracture stabilizing material. So in the hospital that procedures is performing, that a fracture fixing the some materials they are using means that is inclusive in the procedure. Okay, and next to that, debridement performed means. So debridement of open fracture means the codes will be 110102, 11012, and not these two codes. Okay, so these not only two codes, these series codes 110102, 11044, and this debridement performed means it is for the open dislocation, and that exploration is inclusive for the this debridement process of the fracture. Then uh, this debridement of open fracture can be repeated or staged, which means again and again they can do for the fracture care. And while coding this debridement for the fractures means these CPTs we can use that. So already we have given this, right? That one again we can code, and we have to add the 58 modifier. Okay, and once a fracture has been treated and treatment is directed at the management of the wound, report wound management codes. So wound management codes, we have to code for the fracture care. Then this fracture care, if in case they are doing that debridement means we have to that multiple times they are performing for that particular fractures means in that different level means we have to use the 59 modifier. Okay, so same that debridement again and again performed means 58 modifier, that debridement performing for the multiple place means 59 modifier. Then next one, fracture care. So first scenario they have given, you can see the terms manipulation. The patient presents with the disabled distal radial fracture. Orthopedic surgeon reviews the X-ray, pulls on the wrist and snap the bone back into the alignment. That is reduction. You can see this is a manipulation, and applies the fiberglass cast. No incision were made. So with the manipulation they are applying the cast. Then analysis body area means forearm and wrist. Technique, it is a closed, no incision, and action with the manipulation. So with the manipulation or without manipulation, like that we have to check. So the CPT, correct CPT code will be 25605. So closed treatment of distal radial fracture with the manipulation. Okay, so incorrect coding means do not add code for the application of the cast. It is included in the 25605. Because first time if we are using that cast means that is inclusive in this procedure itself. Separately cast code we should not code. Okay. Then next one, arthrocentesis. So arthrocentesis means joint aspiration or injection. Aspiration means we are sucking, and injection means we are inserting something, some chemicals or some substance. Okay. So this arthrocentesis coded based on the size of the joint and that guidance used or not. Okay. So small joint injection can be coded in the IP, MCP, then CMC joint, which means a hand area, that phalangeal, that metacarpal area, then carpometacarpal area, those and all they have given here. As like for this foot also, that phalangeal, interphalangeal, then metatarsal phalangeal, and tarsometatarsal joint. These joints area, they can do these injections. Okay. Then intermediate joints can be coded for the radiocarpal and ulnocarpal wrist area. So next one, they have given a bundled guidance. So if you use ultrasound guidance, it is in that bundled in the CPT codes, which means that imaging guidance is inclusive in the CPT code. Again, we should not build that ultrasound guidance code. So you can see 20604 and 606 me and 611 and all. That is the CPT description itself. Ultrasound guidance like that it will be. So in that time we should not build that 76942 along with the CPT. That is incorrect, because second time we are building that ultrasound payment for that procedure. That is incorrect coding. Okay. So that only they are giving here. Other guidance, if in case they are using fluoroscopy guidance, CT guidance, MRI guidance other than ultrasound guidance, means in that time we have to build separately that guidance code. That only they have given here, plus that 77002 for the fluoroscopic guidance. Okay. Then to build the ultrasound inclusive codes, you must document a permanent image or recording on the needle placement and a formal written report in the medical record. Then they have given examples. So joint sizes, small, intermediate, and major is there, means how we have to use the CPT without ultrasound, with ultrasound. They have given a CPT codes. Okay. This is a example. Then key determinants for the code selection of tendon repair. So tendon repair means how we have to check that one they have given here. First, anatomical location. Which location that tendon got damaged, that one we have to check. So hand, wrist, forearm, foot and ankle. Then tendon type. So what is the tendon type? It is a flexor tendon or extensor tendon. So we can check flexor or extensor. That one we have to check. Then timing of the repair. So once that injury happen, means what is the time taken to give the treatment. So some patients will come within 24 hours for the treatment. Some patients after 2 to 3 days, the still the pain is being, so that's why they are coming for the treatment. Some patients after 10 days, 14 days, like that they will come. So based on the what is the treatment time for the tendon repair, based on that only they will give the consider the care, tendon repair care. So we can see here primary repair means golden period. So within 24 hours they are coming with the clean wound, means it will be best result. If in case they are coming with a 1 to 10 days, that is a delayed primary repair, 1 to 10 days. So sometimes there is a suspicion for the infection, or some that injuries will be there or not, or some additional effects, side effects happen. That and all we have to check in the delayed primary repair. Then secondary repair means it is after the 10 to 14 days up to 4 weeks. So that is a secondary repair. So there is a possibility too for this whatever here, those all are easily followed in the secondary repair. Then late secondary means after 4 weeks. So delay several days if one infected. Okay. So based on that, they are we have to select the CPT, timing of the repair, and zone of the injury. So which place? For an example, specifically whether the flexor tendon repair means zone 2, no man's land. So which is involved in that coding of the particular CPT. So 26356 is specifically for the no man's land. Okay, like that. Then whether the free graft, sometimes some CPTs we have with free graft, without a free graft, like that it will be there. So that also we have to check. For an example, that a particular place they have to check with free graft or without free graft. Okay, then that so the next one, that guidelines and modifiers for the that tendon coding. So each tendon rule they have given. So many tendon codes are built with the per tendon. If surgeon repairs with the both flexor digitorum superciliaris and flexor digitorum profundus in the same finger means you may able to build the both both, but check the national correct coding initiative, which means they are if performing the same place different tendon performing means we have to check the um, NCCA edit. NCCA edit means we will use the 59 modifier should be come or not, like that we have to check. Okay. So same anatomical part means. And next one, graft means graft if they used means in that time we have to use the that specific code for the graft 26352, like that we have to use the that graft specific codes. Okay, then modifier, that multiple procedure performed means we will use the modifier 51, that is usual for the all surgical procedures. And for specifically for the fingers and foot they will have the um, modifiers, so that one we have to use for the specific specify the fingers. Then next one, joint replacement for the by using the arthroplastic method. Okay, so joint replacement arthroplasty. So you can see the image they have given in the shoulder area, that humerus bone. They are giving in the total shoulder arthroplasty means this covering area is there, right? That clinoid fossa. That clinoid fossa also they will fix the replacement, and that humeral components is there, right? That place also they are fixing the replacement, that is total shoulder arthroplasty. Then this is a hemiarthroplasty of the shoulder, so which means that clinoid fossa will be natural only that humeral components they are changing with the artificial elements. Then the next one, reverse total shoulder arthroplasty means that clinoid fossa usually that inverted position, but in the reverse total arthroplasty that humeral cap will be in the inverted position, and that clinoid fossa will be in the circular position. So it is a ulta, right? That's why reverse total shoulder arthroplasty. Okay. Like that, they have given a different anatomical part, total knee arthroplasty, then hip arthroplasty. Not only for the shoulder, that knee arthroplasty also, total, hemi, partial, like that it will be, hip also like that will be. Okay, so they have given an image of the arthroplastic joint. So this is an example for the knee and this is for the hip area. So here we can see total joint replacement means how they are replacing. So in that joint they are replacing by using some metals and plastic and some several ceramic device they are using for the replacement. Okay, so it will be support for the that particular joint to getting um, to avoiding the damage of the particular joint of the particular bones. Okay, so this is a very helpful for the patients who got arthritis, then um, some damage in the accidents. In those people will get replaced with this artificial processes. Okay, So first we are going to see about the primary arthroplasty, which means first time replacement. So so if in case they are coming for that primary replacement, means the CPTs will be if for the total knee replacement means 27447, then 27446 means uni compartmental, like that it will be. If in case revision, which means once that arthroplasty placed and some damage happen or some complication happens, it is dislocated, or some eruptions occurred, or any damage, means in that time that a revision they will do. So if in case they are coming for the revisions, means we have a separate codes for that revision codes. You can see that knee means 2747 486 for the one component, then the entire thing they are changing means 27487, like that different codes will be there. Based on that we have to select the code. Okay, so if they are doing for the arthroplasty, means we have to check it is a primary correction, primary arthroplasty, or are they doing the revision, or they are doing the corrections, like that we have to check. So if in case sometimes some replacement they will do, some particular metal only they are doing, so that and all we have to check. Okay. And this normal procedures they are converting into that arthroplastic procedure. For an example, if they are doing the fracture correction or some that bone corrections, if they are doing the while doing only, they have decided we can do that arthroplasty, means that a replacement they are doing, means in that time we have to use that conversion code CPT. For an example, for that hip, 27132. Okay, then uh, what are the documentation should be there in the coding they have given here. First one is a diagnostic evidence, X-ray reporting showing bone on bone, which means which is the joint, then what is the conditions they will give. Okay, then failure of the conservative care means documentation of the at least 3 to 6 months of the non-surgical treatment for that particular abnormality. Okay, then functional limitation means specific notes on the how the pain impacts daily life. That one they will mention. Okay, next, what are the modifiers we are using? That one they have given 50 modifier. 50 modifier means for the bilateral procedures we are using. For an example, knee bilateral they are performing, means we can use the 50 modifier. And then 54 modifier for that procedure, the doctor perform the surgery but transfer post-op care to another provider. So one physician is performing that a post-op care and all given to the another physician, means that a 54 modifier we can give. Okay, then RTLT modifier for the right side we are using the right RT modifier, for the left side means we are using the left side modifier. 59 modifier means to differentiating the multiple procedures, to identifying the multiple procedures we have to use a 59 modifier. By using the modifier only we are to differentiating those procedures. Okay, so one example they have given here, 50 modifier, total knee replacement on the left and right knee. So both knee they performed, those of 50 modifier they have used. The orthopedist fixes the fracture while patient is on vacation. The patient's global period handles the cast removal. That one given by the different physician. That is a 54 modifier. Okay. Then essential for paired organs, limbs, this particular organs, finger, shoulder, then knees, hand, hip, those and all individual organs performed, means we have to use that RT, modifier to identify the that particular laterality. Then injection in the right shoulder and surgery on the left knee. So injection performed in the right shoulder. So this is a different procedure, and surgery performed in the left knee. So this is a different procedure, and anatomical site as well different. So to differentiating that, we are using the 59 modifier. Then next concept is bunionectomy. Bunionectomy means in the foot area, that condition will be there. So to correcting that Harless valgus condition, so they will do that bunionectomy. Okay, so we have a separate CPTs for that bunionectomy. How they are performing, based on that we can give the individual CPTs. Okay, so you can even you can check that. Grade 2 is there, right? In that place, that medial eminence will be there. That place, some bulge like that structure will grow. That is called as a that Hallis valgus condition or bunion. So that place, they are correcting, and they are fixing the structure of the foot. So if they are not fixing, means it will make so much pain to for patient while walking, and standing in the foot, means that time they may get so much pain. So fixing that, we have a different types of bunionectomy. So uh, you can check. So these are all codes involving this sesamoidectomy. Sesamoidectomy means that removal of some bones. Okay, so the bunionectomy means that they will remove some bones. So that's why the sesamoidectomy they have performed means that is inclusive in the section. Okay, and some osteotectomy means osteotomy means for placing that wires or threads, they will do that osteotomy, that also inclusive. Then next we have check the CPTs. What are the CPTs involving in that osteotomy? So 28297 for the lapidus, then 28299 for the double osteotomy. So in that operative part, um, what are that include, that one they have given here, angulation measurement, which means pre-operative x-ray angles. For that, that angles calculation will be there, how much uh, size we have to cut the bone, how much size we have to correct the bone, those and all they will calculate. So that and all, that degrees they will calculate, that and all inclusive in that procedure. Then conservative cares means that fixing that, they will do some uh, cares, which means after the procedures they will do that shoe, and then padding, then orthotics care, those and all they will give for the 6 months. That one, that is inclusive in this procedure. Okay, like that only. So fracture care means that 90 days is there, right? That is conservative care will be 6 months. Then a detailed technique means the specific bones cut, like metatarsal versus phalanx, that type of the fixation, that plates, pins, these and all we already discussed in the fracture care itself. What are the that elements with like that fixing that fracture, they are placing that screws and pins, that is and all inclusive. Okay. Then next one, they have given a different types of the corrections bunionectomy. You can see first one is a that a medial prominent, that a medial eminence. This is a expansion. It will grow. So because of that, that great toe will be bended, and it will make the pain while walking. So they are cutting in the that medial eminence alone. So next procedure, you can see that medial eminence also they are cutting, and along with that, degenerative joint disease, here it will be that proximal phalanx also they are making some cuts. That colored one is there, right? That places and all they are cutting. Then after cutting with that, they are fixing with the wire. So they will correct like this. So you can see multiple places, based on the severity they will make the corrections. So some places that tarsal also they are making the cut. Some places they are correcting in the that tarsal bone also they are correcting. Like that, different place cutting will be there. So based on that, we have to select the CPTs. Then next to that, spine. Spine we have a in cervical spine means it's totally 7 bones will be there. Thoracic spine means 12 bones will be there, and lumbar spine means 5 bones will be there, and sacrum bone 5 bones. It is connected, and the end of the part that tailbone will be there. That is called as a coccyx. Okay, so the coccyx alternative name is tailbone. Then next to that, in the spine area, what are the procedures they are performing? They have given here. So that is a first one is a vertebroplasty. So vertebroplasty and vertebral augmentation procedures, those and all they will do. So in that vertebroplasty, vertebral augmentation and all, if they are performing that biopsy, sedation, and imaging guidance and all, it will be inclusive. Okay. So vertebroplasty means biopsy, sedation, and imaging guidance are inclusive. Okay. Then, so once a primary procedure is reported, if in case additional level performed means that add-on code for the each level we have to give. That one they have given here. Okay. Then next to that coding tip, percutaneous vertebral augmentation procedures means this CPT is for the thoracic lumbar areas only. If in case cervical vertebral augmentation is performed means we have to use the unlisted code. Okay. So percutaneous vertebral augmentation performed means these CPTs only. Cervical code for the cervical we don't have a separate CPT, so we have to use the unlisted code. In maybe in the future it may get a new CPT. Okay, so they have given an image for the particular vertebroplasty, kyphoplasty images and all. You can see that there is a crack in the vertebral bone. So they are fixing with the cement injection, which means percutaneous method. They are injecting the cement in the cracked area, so it will be get fixed. Okay, then percutaneous kyphoplasty means by using that augmentation method, they are placing some cements and they will make that strong in the particular but they will make some balloon like structure in that inside and they will fix with the cement and they will fix the fracture. Then next one, arthrodesis. Arthrodesis means surgical fusion of the joint. So if in case joint is not in the good condition, so we have to fuse that bones or by using that spins and wires or some plates. So they are fixing means that one will be taken care in the arthrodesis procedure only. So you can see they have given an image of the arthrodesis. So that is called as a spinal arthrodesis. So you can see they have given a build a code system. That is spinal arthrodesis means build a code system. So that four components they have given, what are the approach they are doing, that one they have given here. So first one, approach and technique. What is the approach they are performing? Already we discussed, right, that approaches and all. Then anatomic level, which vertebra they are performing, and that bone graft if they performed means if they may used. Then instrumentation means that screws, rods and cages if they used means that instrumentation we have to check. So here cervical spine, spinal area fusion they are performing. Okay, so that one we can check here. So in this place they are approaching with the open approach only. They are making the open. They are fixing the that level. What is the level? It is done. Then what is the procedure? If they used that screws or anything, if they perform means that one we have to check. Okay. So then next to that approach and technique means what are the approach they are performing they have given here. So surgeon uh, reached the spine means how that side means what is the approach, anterior, front, posterior, back, lateral means side. So for an example, in our cervical spine means our front neck area anterior approach, then back neck area posterior approach. But our hand side means lateral side if they perform means that is lateral side approach. Okay. And here they have given a that anatomical part name of that each vertebra. So posterior, this is a posterior one. Then transversectomy, this place. Then transpedicular place. Then lateral extracavitary place. Then this is a lateral place. Like that they have given. Then anatomical level of fusion. And in the coding, that fusion is very important for that spinal area. That fusion may be occurred by the own means, naturally it can be occurred, which means if the patient is a elderly patient, they may get a natural fusion, which means their bone density is very less. Because of that, it may get one bone to another bone get fused. um, it may lead to severe pain and severe changes in the human body actions. Okay, so that is a conditions. So fusion happen means we have to check that is a treatment or it is a abnormality. Sometime that fusion will be done by the physician. That is a treatment. If in case won't they are got the fusion means that is a condition. Okay, for an example, that while getting the accident, the cervical bone is dislocated means in that time physician uh, physician um will do the treatment, and they will connect the bone, whatever dislocated bone. That is a treatment. But if in case um, um, because of degenerative conditions, the two bones are getting fused means that is a abnormality. Okay, so that one we have to be more careful. If they documented in the report fusion means we have to check that is a abnormality or treatment. So here uh, they have given a example how it will be. So the fusion codes are, that is spine codes are usually defined as a single level or single interspace. If the surgeon fuses more than one level means you must add the add-on codes. Okay. So yeah, then a level means how it will be, they will document. L4 to L5 is a one level. L3 to L5 means it is a two level, which means L3 to L4, L4 to L5. So like that, we have to check the levels. Then rule. You build the primary code for the first level and the add-on code for the each additional level. Then instrumentation. Instrumentation, how they are placing that processes, that and all they have given here. It may be segmental, it may be non-segmental, it may be interbody device. You can check. Segmental means that segment like it will be divided. In non-segment means you can from this to this level one rod only they will place. That is non-segmental. Then interbody device means like in between from this one vertebra to another vertebra, they will connect with the some cages. That is a interbody device. So you can see segmental. So every level, the segments will be there. One level like that, it segments are wise they have placed. That is a segmental. Then separate plate fixation means how they are placing that plates. That one they have given. Then integrated cage means in between the two vertebra they will place like these cages. Then next one is a bone graft. Bone graft means artificially we are placing that graft. That is a bone graft. So sometimes it may be some artificial bone, or sometimes they may from the uh, one person to another person. For an example, one person to another person means that a cancerous patient will get the healthiest bone from their own family, same blood group, whoever got from their spinal guard, one vertebral body they will collect from this healthy person to that a cancerous person. So which means that from the healthy person, that a bone marrow will be there, that immune cells against the cancerous cells will be there in the healthiest person. So that will be transferred to the cancerous person, means they may get that same immunity cells from this healthy person to cancerous person. Okay, so that is a place they will do the bone graft. Like that, if they are doing the bone graft means we have to check that artificial bone collected, then how they are placing that, how they are fixing in the person, those and all they will check. So you can check that autograft means a patient's own bone. From their own bone, they are collecting and they are placing. So, obtained from the same incision, bone removed during the laminectomy, then included in the fusion code, do not build separately because taken in the same patient, they are collecting and they are placing. Then separate site are obtained from the different incision, different place they are collecting means we have to use the separate codes 20900 and 20902. Then spine graft codes. So we have a specific spine graft codes. So for an example, martialized allograft like that. So that and all we have to use the specific codes, whatever codes for the spine graft. Then total disc arthroplasty, you can see this instead of this disc area, they are artificially fixing the artificial disc that is called as a total artificial disc replacement. Like that it will be, and these codes also lumbar and cervical will be there. Thoracic is not available. So if in case thoracic codes is not separately there means in that time we have to use the unlisted code. So you can give that some notes they have given here. So incision made in the back posterior, then laminectomy performed in the L4 to L5. The disc was removed. Then peak cage was inserted in the interspace. Pedicle screw and rods were placed in the stabilize the L4 and L5. Bone marrow was aspirated from the iliac crest through the separate incision for grafting. So how we have to check that one they have given procedure posterior interbody fusion. So CPT code 22630. Then hardware. What are the hardware? So the peak cage is disc space. So 22853. Then hardware rods and screws they have mentioned, right? So 22840. So for this posterior non-segmental instrumentation, but notes they have given even through it attached to the 2 points L4 and L5. Short construct are often mapped here or 2284 depending on the strict definition of the segment spanning. Okay. So or means they are documenting in the two level also they are connecting in the one place. So they are given the 22840. Then graft bone marrow from the separate site. So 20939 for the bone marrow aspiration. Then arthroscopy codes we are using 29800 to 29999. So these are the codes we are using for the arthroscopy. Arthroscopy means it is using the camera to analyze the bone. Okay, so mostly for the arthroscopy, the code is having that bundling rules is there means we have to strictly follow that bundling rule. And if in case some places it is separately billable means in that time only we have to use the separate code. Okay, so here that diagnostic versus surgical they have given. So diagnostic arthroscopy always included in the surgical thoracoscopy of the same joint. This is a very important rule. Mostly people will get a question in the exams and all. Diagnostic procedure performed and surgical procedure performed means they will get that option both diagnostic and surgical. That is inclusive. We have to be more careful. Okay. So in that time we should not build the diagnostic code. Only surgical arthroscopy code is enough. Okay. Then scenario, the surgeon scopes the need to look for the damage diagnostic. She finds a torn meniscus and repairs it, which means surgical he done. He found in the abnormality in the diagnostic image, but he repairs. Means repairs means the surgical procedure done. In that time, we should not code a diagnostic. So you will bill only the repair. The looking around is considered part of the surgery. Okay, then exception. You can only bill a diagnostic code if the procedure ends without a surgical repair or removal being the performed. Okay, so if the correction is not done, only diagnostic part only done means in that time diagnostic code we can code. Then converting scope to open. If in case they are doing that arthroscopy, but it is not succeed, in that time they will do the open procedure. If a surgeon start with the scope but cannot fix the problem and decide to cut this joint open to finish the surgery, then bill only the open procedure. The scope is considered as an integral part of the failed attempt or exploration. Okay, so in that time scope we no need to code that is uh, um, failed attempt, so we cannot build. Then joint specific guidelines will be there in the concept, so you can check. So the shoulder part they have given these of the CPTs. Some joint specific guidelines will be there. So shoulder coding relief heavily or understanding in decompression versus repair. So subacromial decompression if they performed means this involves shaving the bone, acromyoplasty, to relieve the pressure on the rotator cuff. So we have to code add-on code 29826. It cannot stand alone. It must be listed on the claim after the primary shoulder scope code 292 29827. That one we have to code, then add-on code we have to use. If the surgeon only does the decompression, you usually have to map it to the debridement code 29822 or 29823 depending on the payer policy, as 29826 is strictly an add-on in the CPT book. Okay, then next one, debridement. Debridement performed means limited versus extensive, we have to check. So 29822 is a limited, cleaning up one or two district structure. Then 29823 is a requires debridement three or more separate structure. Example, rotator cuff, labrum, and biceps tendon. The operative report must explicitly detail work in the multiple area to justify the higher paying code. So how they are performing based on that only we are giving the CPT. So it will decide the uh, payment of the procedure. Okay. So how much level they are performing and how much deeper they are performing, we have to check. Then shoulder area, that shoulder scope they have given. So our operative report performed, that one we have to check. So shoulder scope means scope inserted, patient has full thickness, rotator cuff tear which was repaired using the anchor. Also performed a subacromial decompression to remove the bone spur, preventing the impingement means coding analysis, rotator cuff repair 29827. Then if in case the decompression performed means 29826, that is add-on code. Okay. Then if in case in that time they have what is the CPT code will be 29827 for the arthroscopy code, then 29826 for the add-on code for the decompression. So here 29826 is add-on code. So no 59 modifier needed. And the RT modifier if you are adding means it will be helpful. RTLT means. So this also in the CPC exam, some of the options they are giving this 51 modifier for these like procedures. Add-on code given means for the add-on code we should not use the 51 modifier. Same procedure only we are doing in the different level. So 51 modifier is denoting multiple procedure, that is not a multiple procedure. Okay, next one, knee joint. Knee joint guidelines, what are the guidelines they are following? That one they have given here. The knee is most commonly scoped joint. To code it, you must visualize the knee three separate component. What is the component of medial, lateral, patellofemoral? I already told, right? Medial means towards the body side, lateral means outward the body side. Okay, so medial or lateral, patellofemoral means that front one. This patella will be located in this place, no? That place. Okay, behind the kneecap. So here they have given a meniscectomy rule. So removing the torn cartilage. So meniscectomy, that damaged torn cartilage they are removing. So 29881 is a meniscectomy, one compartment, medial or lateral. Then 29880 meniscectomy in two compartment like medial and lateral. So here we have to check one compartment or two compartment, like that we have to check. Okay, then you never build 29881 into 2. So if in case if they are performing two compartment means we have a specific codes, that's why we should not use this code into 2. Okay, that only they are telling here. Then next one, chondroplasty, which means shaving articular cartilage. If the surgeon shaves cartilage 29877 in the same compartment as a meniscectomy, it is bundled. Okay, you cannot bill it. So, if in case chondroplasty performed means, if they are performing with the meniscectomy, no need to bill separately. Okay, if the surgeon shaves cartilage in the different compartment from the meniscectomy, some non-Medicare payer allow it, but a Medicare patient, which means that the NCCA edit coverage, generally bundle simple debridement into the main procedure regardless of the compartment. Often using the G code like G0289 for the Medicare. Okay, so this whenever they are doing that shaving cartilage in that place, if they are performing in the along with that meniscectomy performed means for the non-Medicare payers they can allow, but the Medicare payers means we have to check the that GC CPT code. Okay, under CCA edit. Then knee arthroscopy, second scenario. The clinical scenario, the surgeon inserts a scope into the right knee to investigate the pain. She finds a torn medial meniscus and shave it down, meniscectomy. She also look at the lateral compartment and see it is healthy. So here the procedure arthroscopy is surgical. And specific section meniscectomy they are doing shaving or removing. So here the looking around diagnostic part of the surgery is inclusive, right? So no need to code the diagnostic part. So we have to code the arthroscopy code 29881 and we have to use the modifier RT or L2. Here they have performed for the right knee, so we have to use the RT. Then knee mosaicoplasty. Mosaicoplasty is that damaged cartilage place. They will replace with the healthy cartilage place collected some cartilage disc. That one fixed in the damaged part. Okay. So knee mosaicoplasty also known as a WOTS, which means osteochondral autograft transfer system. It is a sophisticated restorative procedure where plaques of the healthy bone and cartilage are harvested from the non-weight bearing area of the knee and transplanted to the defect in the weight bearing area. Okay, which means that the healthiest place. Non-weight bearing area means whenever we are standing while holding the weight, which place is not getting much pressure, that place cartilage they will collect, and that front place only we used to get the more pressure. In that place they will replace. Okay, then the all inclusive nature of the wounds. So the code series will be in this area are comprehensive. This means the following are bundled or cannot be built separately. Okay, then a diagnostic arthroscopy, looking at the defect before fixing it. Debridement and site preparation, preparing the hole or which means the defect to receive the plug. Then harvesting means the act of the taking the bone from the donor site, means that a healthy place. Okay. So while coding that process, how we have to check that decision tree they have given here. When you see the votes or mosaicplasty in the operative report, you must answer two questions. First one is what is done through the scope or open decision, incision. So if they are performing with the scope or open. Okay. Next one, what was the graft or autograft? Means patients who own graft or allograft means some of patients, other patients are cadaver. Okay. Then autograft means patients who own bone or cartilage. So we have to use the CPT 29866. The surgeon uses the scope to harvest the plaques and transplant them into the defect. Then open procedure means 27415. The surgeon makes a large incision arthrotomy to harvest the place the graft. Then allograft means 29867. Arthroscopic means the CPT. The surgeon uses the donor plugs and places them via arthroscope. And open means 27416. The surgeon perform the open procedure using the donor material. Okay, so here you can see the image of the mosaicplasty. So this is a place they are getting, they got damaged. So they are collecting the healthy place, that damaged one, and here they will replace. See, this one harvested site, and this is a damaged place they are placing. So that one they have given a CPT 29866. Then ankle ligament area, what are the procedures they are doing? That one they have given here. Tenotomy and tenodesis. Tenotomy means the surgeon cuts the tendon and release the tension. That is a tenotomy. The CPT series will be 28230 and 28232. So this is a tenotomy CPT codes. Tenodesis means the surgeon anchors a tendon to a bone. Okay. Then tendon repair means 28200, seeing the tendon back together. Okay, that is a tendon repair. So the CPT series they have given in the individual anatomical part. First one is lateral malleus 27792, fixing the fibula, outer ankle only. Then medial malleolus 27766, fixing the tibia, inner ankle only. Then bimalleolar 27814, fixing the both inner and outer side. Then trimalleolar 27822 and 23, fixing the medial, lateral and the posterior lip of the tibia. So next, excision of the soft tissue tumor they have given here. So clinical scenario, a patient has a 4 centimeter lipoma removed from their upper back. The surgeon incises the skin and removes the tumor, which was located just below the skin but above the fascia, means subcutaneous area. Okay. That analysis, what are the analysis we have to check? To code the soft tissue excision, you need to two things: location, depth, size. Okay. Then location means back flank. They have mentioned back flank. Then 21930 series. Then depth subcutaneous, non-subfacial, intramuscular. So size 4 centimeter. The correct coding will be 21931, which means excision tumor soft tissue back flank subcutaneous 3 centimeter or greater. Okay. Then training scenario. So knee cleanup and repair. So scope inserted in the right knee, medial meniscus was torn and the loose flap was removed. In the lateral compartment, the articular cartilage was frayed, so I performed chondroplasty to smooth it. Meniscectomy in the medial compartment 29881. Chondroplasty in lateral compartment. So commercial payer 29881 that meniscectomy code they have given. Then 298759 RT distinct service separate compartment. For the Medicare patient means how we have to code 2988 only. This chondroplasty we cannot code. So Medicare consider the shaving bundled or requires G0289 depending on the specific year LCD rules. Generally, rarely pays for the debridement with the meniscectomy. Okay. So for the non-Medicare only, we have to check 29881 and chondroplastic code with the 59 modifier we have to use. Okay. Understood, right? Bhuvana, are you there, Bhuvana?
Yes, ma'am.
Uh, Clear, right?
Yes, ma'am.
Musculoskeletal system.
Yes, ma'am.
Oh, okay. Is there any doubt?
No, ma'am. It's clear. It's all clear, ma'am. No doubts at all.
Okay. Okay, Bhuvana.
Ah,
In
okay,
next
ma'am.
class, Monday it will be.
Okay,
So
ma'am.
next class, we will discuss about I think um, digestive system.
Okay, ma'am.
Mm.
Okay, ma'am. Thank you, ma'am.
Okay, okay, Bona. Thank you.
Thank you, ma'am. Thank you so much.
Mm.